The ER doctor said my 8-year-old was just anxious. 24 hours later, surgeons were fighting to save her life. My daughter Lily has always been my little warrior, Apollo, fearless, rarely complaining about anything. So when she woke up one Saturday clutching her side and crying in pain, I knew something was seriously wrong. By noon, her pain had localized to her lower right abdomen. My nurse practitioner sister texted immediately. ER. Now Fothway like appendicitis. The local emergency room was packed when we arrived. After a 90-minute wait, a harried doctor finally examined Lily for approximately 3 minutes. He pressed on her stomach, asked if she had a history of anxiety, then looked at me with what I can only describe as condescending certainty. She's exhibiting classic signs of childhood anxiety, he explained, not speaking to Lily but over her as if she weren't there. Kesik internalized stress physically. Her vitals are normal, no fever. She's just having a panic attack. I mentioned my sister's concern about appendicitis. He actually rolled his eyes. Every parent with WebMD thinks their kid has appendicitis, he said. If it were appendicitis, she'd have a fever and wouldn't be able to jump. He asked Lily to hop. Through tears, she managed one small jump. Appendicitis patients can't do that. Give her some children's Farinol and maybe consider therapy for anxiety. Something felt deeply wrong, but who was I to question a doctor? We went home with a pamphlet about childhood, anxiety, and a prescription for parental reassurance. That night, Lily's pain became unbearable. Her skin felt hot to the touch. By 3 a.m., she was vomiting and couldn't stand straight. We drove an hour to the children's hospital in the city. This time we were taken back immediately. The pediatric ER doctor ordered blood work and a CT scan within minutes of seeing her. Her white blood cell count was through the roof. Her appendix has ruptured, the doctor explained gravely. She's developing peritonitis pert infection throughout her abdominal cavity. We need to get her into surgery right now. The surgeon later told us it was one of the worst cases of ruptured appendicitis he'd seen in a child. Another few hours, he said quietly, and we might have lost her. Lily spent 9 days in the hospital fighting a massive infection. She needed a second surgery to drain abscesses that formed. The pediatric infectious disease specialist explained that because the appendix had ruptured at least 24 hours before surgery, the infection had spread extensively. When I told them about our previous ER visit, the surgeon shook his head in disbelief. And many children with appendicitis don't present with fever initially. 3 months later, after Lily had finally recovered, I received a call from the hospital administrator of the first ER. They had conducted a review after my formal complaint. The doctor who saw your daughter has been required to undergo additional pediatric emergency training, she explained. We've also implemented new appendicitis screening protocols for all children presenting with abdominal pain. I think about that first doctor often, how he dismissed a child's pain as just anxiety, how he seemed more interested in moving to the next patient than listening to a mother's concerns, how his certainty nearly cost my daughter her life. I've learned that being an advocate for your child sometimes means being labeled difficult or overreacting, but I'd rather be difficult than standing over my child's hospital bed wishing I had pushed harder. Trust your instincts. You know your child better than any doctor who spends 3 minutes with them. Sometimes being a good parent means being a bad patient.